Thank you for being here. This is a really exciting day. We're here to announce that we're going to have an embedded social worker working with the Norwalk Police Department, assisting them in various activities. You know, a couple of years ago, we had issues where people were dealing with officers were having to deal with emotionally disturbed people. Sometimes the results were tragic, and we wanted to recognize the fact that there are people out there with special needs who aren't necessarily going to be able to be dealt with by the police department. So I want to thank the police department for what they've done. They recognize the fact that we need greater resources when dealing with people who are emotionally challenged, emotionally disturbed, whether it would be something from the pandemic really created a lot of these issues where people were just frustrated, very isolated and so forth. So it created a lot of problems. And when we started talking about this, the police department knew that we needed to do something to provide greater equity, greater justice, greater care for people who need that kind of care. And so they searched and found a model in another police department that I'll let the chief speak about that seemed to be working. And the best model to go after is the model that's being tried someplace else and is working someplace else. And of course, we take that model and we fit it to meet the needs of Norwalk so that it fits our model even better than perhaps some other model that would be. So as I said, at the same time, many people in the community and nationwide called for leaders to find new ways to better address equity and enhance community police relations. And that's what this is all about, community police relations. You know, we know in Norwalk, the community and the police work very, very well together, but we want to find better ways of enhancing that, finding ways that we can increase that level of working together so to better serve the entire community. So I wanted to introduce, Chief Kaholic and Deputy Chief Walsh brought the idea of adding an embedded social worker to our department. You're over this side. And we knew that other police departments across the country were bringing on social workers and clinicians. And we think this is something that's a positive and it's going to really, really work well. So I would like to introduce Chief Tom Kaholic to say a few words and talk a little bit about it.
Thank you, Mr. Mayor. Yeah, as the mayor said, we identified several years ago the need to do more, enhance our services, and we knew that even though our officers are trained, they don't have the professional training that a professional, mental health professional, as I said, professional has. So we started looking at different models and how we could do that, and we came up with a few ideas. We couldn't get those off the ground for a variety of reasons. And then Deputy Chief Walsh brought to my attention a program in Stanford. Stanford Police Department had started working with the recovery network of programs out of Bridgeport. And that program was very successful in the 6 months in Stanford thus far. When we were looking at it, we went to the city, we went to the council and the mayor, and they were very supportive of that. And we were able to bring on the recovery network, and now we're now able to bring on an actual clinician that has joined us about 2 weeks ago. So I want to introduce Alex, and she'll be working with Sergeant Galino as our kind of behavioral health unit that'll be handling a lot of these issues and following up. And I'll just let them briefly just talk about what they're doing and how they're going to do it.
Thank you, Chief. So I'm Sergeant Sophia Galino. I am overseeing the behavioral health unit now, and we're hoping to expand in the near future. In the last 3 weeks that Alex and I have been working together, officers have already been providing us with a lot of information and people that they wanted us to connect with. It's just been so exciting to see how everybody has been welcoming this, not just from the police officer standpoint, but also the community standpoint, and I think all of the social services that they're working with. This is more about bridging all of the needs that we have here. There's so many resources in the community. The officers are very adept at handling these calls, but now it's pulling all of these pieces that where there might be cracks, pulling them together. And Alex has been phenomenal to work with as our first embedded clinician and is really setting a wonderful role already.
And I think Sergeant Galino took the words out of my mouth. I just really wanted to thank everyone for being so welcoming, and whether that's the police department or all the community members, community partners. it was a pleasure to come into this and have those people be so warm when I've been reaching out to them and trying to make the connections. And I'm really excited to be part of this initiative.
Yeah, I think we're doing something that's really novel, and we're building something that may even be replicated, and I'm very proud that Norwalk is starting that off, so thank you.
Thank you, and I'll say we've just been joined by Common Council member and soon-to-be State Representative Dominique Johnson. Congratulations. And you know, it's so important. You know, a couple of years ago, we recognized the need in Norwalk that we used to have a social services agency that was run by the state, and they took that person and moved them out. And so a lot of people in Norwalk have been struggling to find access to the resources that are available in Norwalk, and we have a lot. And so we decided we're going to form a community services division and hire a community services chief to oversee it. And not only is he doing a remarkable job in bringing people together, but all the nonprofits and all the service agencies in the city of Norwalk were kind of operating independently. They weren't working together. Maybe they were working together, but not really closely. They were probably a lot of duplication of effort. They're all fighting for the same money, all fighting for the same dollars. Now, what we've done now, every Friday morning, Lamont hosts a community providers roundtable. They all get together, they talk about issues that they're finding, things that are happening in the city of Norwalk, things that might be missing, things that we might need. And so it's been a remarkable partnership with Lamont and the people that are running the nonprofits in the city of Norwalk. So I wanted to introduce Lamont now, and then we'll introduce Alexandra Fitzner. Who's that? Yeah, oh, we've already done that. Okay. So Sophie is taking care of that. So I want to introduce Lamont Daniels now. You know, people who work with Lamont know that he's a remarkable young man, works very hard. He's passionate about what he does, and there's so much going on. And I don't know where he gets his energy, because I get tired when he's talking. So, so anyway, Lamont.
Thank you, Mayor. Thank you. This is a great day here for us here in Norwalk. So I want to thank the mayor, thank Chief Kahalik, welcome Alex, Sergeant Galena. I said, let me write this one down because I wanted to say a couple of points. So I'm excited today because today represents a significant resource in the police department to help respond to those critical needs that you probably heard us talk about that are often mental health and behavioral health related, including substance abuse. As the mayor pointed out, through the Community Services Department, we also launched under Mayor Rilling's leadership the Community Resource Hub, including Deanna DeMore, our health director, and Anna Vivian, who's out at a meeting, our Human Service Department. So we'll be working closely with the team at the police department so that when unmet needs arise, the appropriate referrals are activated and resources and supports are identified and follow up. We have a model here in Norwalk that there's no wrong door. And this approach basically means that whatever door you come through, our goal is to help you find the resources that best meet your needs. While we do want to discourage everyone going through the law enforcement door, but the point is seriously that we're here to help, and we're really excited for Alex and the great work that Sergeant Galena has been doing prior to this initiative. So having a clinician in the police department and the amazing partnership with the Recovery Network of Programs continues Mayor Rilling's leadership around our commitment, which he charged me to do, is to support a comprehensive strategy to identify those critical services to serve our residents who are in crisis or who are in need of support and resources, and also to assist them, help identify them. And through Mayor Rilling, we launched the Family Navigation Program. So again, I want to thank everyone for being here. I want to thank some of our nonprofits who are here with us this afternoon. We need everyone to support us. Chief Kahalik again, and the wonderful partnership that we're going to build with Alex while she's here. So thank you so much. Thank you, Mayor.
Now you see what I mean? So now I wanted to introduce Jennifer Kolakowski. Is that to have a couple of words?
Thank you, Mayor. Good afternoon. My name's Jen Kolakowski. I'm the CEO of Recovery Network of Programs, and I am so honored to be here today, recognizing this incredibly important milestone for the city of Norwalk. I will keep my comments brief, but I do want to commend and express our deep gratitude to Mayor Rilling, Chief Kahalik, Lamont Daniels, and our council members who selected RNP for this impactful, innovative program that will have a profound positive impact for the residents of Norwalk and the community at large and the police department. In this partnership, RNP has a full-time licensed clinician, as you've heard from Alex, and we will be adding another part-time clinician, and both will be embedded directly in the Norwalk Police Department. And as you've heard, we piloted this program initially with the Stamford Police Department, and in our first year of operation, we've worked with 300 unique individuals and have provided over 800 interventions and community connections to care while reducing call volume by 20%. And we have no doubt that we will have these same positive outcomes in the city of Norwalk. I want to just add, I would be remiss if I did not mention that behind the scenes of a very large part of our success is, and what distinguishes this model from others across the state, is directly related to Frambiel Rodriguez, who is in the back of the room, a retired Stamford police officer who leads this work at RNP and brings his firsthand knowledge of law enforcement to these partnerships, which has been absolutely critical. So RNP will work collaboratively and in an integrated manner to ensure we leverage all the existing resources in Norwalk, of which there are so many great organizations and programs, many of whom are represented here today, to ensure that individuals are connected to the care, the support, and the resources they need to strengthen the Norwalk community. So thank you so much. We are honored to be a part of this program.
Thank you, Jennifer. You know, all too often when you're dealing with an EDP or a victim of domestic violence, once the intervention is over, there's no follow-up. And the follow-up is critically important to make sure that people realize this is not just one time. I'm going to be getting the support that I need, the follow-up, to make sure that I'm getting the therapy or getting the services, or if somebody gets followed through the court system, just to show that person they're not alone. Because a lot of times when you don't know which way to turn, or you're a victim of domestic violence, you just feel alone and abandoned at times. And this is going to be a big plus for the people who are in Norwalk, and we're really, really excited about it. I want to introduce Councilperson Jen McMurr to have a few words, and then I'm going to open the floor up to any other council person that wants to have a comment. Jen?
Thank you, Mayor. Thank you, everyone, for being here today. It is truly a wonderful day, and I'm proud to be standing here with all of you, all the people that made it possible for the police department to have a clinician on staff. I want to welcome Alex. We are all here to support you any way we can, and we are very excited to have you as part of the team. I want to thank the mayor, the chief of police, Chief Daniels, and everyone else who made this initiative possible. Thank you for all of your tireless work that went into this. I am especially proud of this for two major reasons. One, now more than ever, many of our citizens are facing mental health challenges and need help. I'm so glad we have another resource to help them in this area. And two, the police department put their lives on the line for us every single day, and every single day they put on their badges. I am happy we can offer them another tool to aid in that already difficult job. Thank you so much to everyone again. This is a very job well done.
Thank you, Mayor. Just very briefly, we've heard words such as collaboration and partnership. I'd like to add another word, which is innovation. You know, we saw an example of how a model worked in a neighboring town, and we did not hesitate to say, why not Norwalk? Why don't we use some innovation, bring it to Norwalk, and provide this additional service to our residents here in our great city? So I just want to commend you for doing that innovation and taking the next step to make living in Norwalk that much better for all residents. So thank you for that.
I will be very brief, but as Chair of the Community Services Committee, I just want to commend our Chair Daniels and Chief of Police Kahalik for doing what, as Greg and others have mentioned, is such an innovative partnership because it builds bridges even more for us, and it's going to bring to bear the full breadth of our community nonprofits to help people, as Chief Daniels and the mayor have said. So thank you, Mayor, for being a leader that sees the importance of this collaboration. Appreciate it.
Well, thank you, and if there are any questions, I'm sure there are plenty of people up here who'd be more than happy to answer any questions you may have. I know, Harold, you always have a question. Always.
So I understand how this works. You're full-time in the building,
Yes.
and you're there to respond with officers who are encountering an EDP situation on an emergency basis? Is that how it works? Could you go to the podium, please?
Sure. So at some point, we would like to incorporate that into what I do on a daily basis. As of right now, what I've been working on is receiving referrals directly from patrol who are responding in the immediate situations. And then following up with aftercare and determining what needs need following up with.
If I can just comment to what you had just asked, we actually just walked down the street. I
Right.
think when you were getting out of your car, you saw us walking down to person. They were having an incident with a person that we've identified in our community as in need. So that was a call that was actively coming in over the air, and we assisted the officers and were able to bring that to a successful closure. But right now, if we walk around this building and we ask the Detective Bureau or Combined Dispatch or any of the other divisions if they know of individuals in our community that they have already been identified and need services. There's already a long list, I think I said before, in the 17 days that Alex has been working with us, we've already received a ton of referrals and have already reached out to about 25 and are setting them up with services or doing aftercare. So it's been very busy, to say the least.
All right, well, getting back to handling these emergency calls, an issue that's been going on since as long as I can remember covering the police department is that emotionally disturbed people are taken up to the hospital. Maybe they spend a couple hours there, and then the officers encounter them back out on the street before the day ends. So are you bringing access to resources that the officers to date have not had in the past?
I can comment on that too, if you don't mind, Liz, did you?
Go ahead.
So I think a big part of our catchment, I don't know if is that better? A big part of our catchment is not only responding to what you're calling EDP or emotionally disturbed persons,
Right.
but even more critically is when there is a sexual assault or a critical car accident or somebody has died by suicide, there's family members that are impacted by trauma. Those people who are impacted by trauma lose the resilience that they have 10 years from now, 15 years from now to cope with difficult situations. So by us responding and connecting to people with resources prior to them having any significant downward spiral, we're hoping to slow down that type of action within our community. As to people that are currently struggling, yes, there are some bridges that they just haven't been connected. People didn't realize that a resource has already happened. We have community care teams that we can, there's more beds that we knew about that might be an option. So all in all, we do have a difficulty with trying to find a place for everybody, particularly winter's coming, and we're trying to house everybody, but Connecticut has done a wonderful job, and particularly Norwalk, in getting people off the streets very quickly. So that's probably one of our major focuses right now, but to answer your question in a short way, yes, we're connecting those bridges to help those people who are in crisis and not keep being kept anywhere.
Okay, but I'm still not following.
Okay, which part?
I think I can address your question.
So we have an EDP call. Are we no longer taking that person in Norwalk Hospital?
So essentially, yes, we are still using the hospital as a resource.
Okay.
However, I think what's great about having a clinician right here in the police department is that instead of having officers do that follow-up where they consistently might have to cycle through bringing that person to the ER again and again, I can do follow-up with the hospital directly and say, hey, we brought this person in, what are the resources that they're being connected with? So they're not just getting discharged and immediately brought back. what can I do to help make sure they're getting connected with resources outpatient-wise? And that's where my role is.
So you respond to the hospital when you're aware of somebody
Yes.
having been brought up there?
Or even just making the phone call and making the connection and saying, when there's somebody there, what can I do to make sure that that person's getting connected to services outside of the hospital?
And Jen, would you just mind just share why we chose Recovery Network of Programs, just the variety of services that you offer? I think that was really a big piece of why we chose Recovery Network of Partners.
Sure, thank you. So one of the very unique aspects of Recovery Network of Programs is that we have 25 distinct programs. We have the largest continuum of care in Southern Connecticut, and so we have the ability to, again, I just want to stress that we leverage the services that already exist in the community first. If there is a gap in service, or if there's a delay, or somebody has to go on a wait list and RNP can step in, we prioritize those admissions and can do same-day admissions in terms of outpatient, inpatient. So we really have a very extensive continuum of care that we bring to the table and an infrastructure that allows, us to support the clinician in the department.
How much is this program costing? Is it the $200,000 and is it through the American Rescue Plan?
That is correct.
Okay. What's the exact cost?
216, I believe we quoted to the, from the,
216 or
200, how do you say, 216,000, right, that we allocated.
And what about the calls that you guys, Norwalk Police has received? How many calls have you guys received for mental health services to get to the point where you really do need someone embedded in?
So one of the most important aspects of this program is going to be gathering data, and I did pull statistics from approximately January 1st to July 1st, and right now I've identified approximately somewhere between 400 and 500 calls for service that did not get the type of follow-up that Alex may be able to do. Not to say that we can keep up with 400 calls on our own, but yeah, there's plenty to be done here.
What types
So.
of calls are those?
It could range from anything like domestic violence. It could be a simple disturbance. Somebody's making noise in a street. It could be something more intense like a critical incident, somebody on their worst day experiencing a sexual assault. We've had so far a stolen car. We've had some arrest situations. We've had an individual who stopped eating for several weeks because of psychosis. So the catchment is very, very large.
I'm sorry, I don't remember your name, but as far as your agency goes, I'm more familiar with, I think it's Du Bois, is that down in Stanford? Is your agency the equivalent to that? Could you explain the difference?
Sure, absolutely.
Because that's who I'm used to them
Of course.
calling.
So Recovery Network of Programs is a nonprofit behavioral health care organization. Du Bois is a state-operated mental health facility. And so the equivalent of that in Bridgeport is Bridgeport Mental Health. Du Bois is in Stanford.
So just to follow up with what Jen's saying, we're still utilizing both. RNP is going to be another tool on our belt, and officers still have access to calling the crisis line 211 and having a clinician from Du Bois or the mobile crisis center show up with critical incidents, because Alex is not here around the clock. So they have a little bit more expanded hours and a few more clinicians available.
Being she's not around the clock, what are her days and hours here? I could just say during the course of the day, or?
So I'm typically here Monday through Friday, 9 to 5. Probably I'll be able to expand or flex my hours in some ways that meets the needs of the department as I kind of get to know my role. And I've just started here, so it's still kind of growing and evolving, so.
And will you be going on active calls with the police department, or just more like follow-up with the hospital and stuff?
Again, yes is the short answer, but that's kind of, I wouldn't be the first immediate person on scene. This would be kind of as a follow-up.
So back in 2021, I did a story with Stanford Police. So with Chief Shaw there, they actually embedded a social worker as well. I don't know if it's through,
Yes.
it is the same
It is the same program,
Okay,
yep.
and I believe her name is Carolina. I
Yes.
did a story with them. Chief Shaw mentioned to me that police officers are just not trained to handle these calls. They're not trained in everything that they do when they go out there. Could you talk about the importance of having someone embedded, a social worker,
So-
to aid police officers like this?
Officers now in the Police Academy are receiving mental health first aid, which is an 8-hour program. We additionally have many officers that are CIT, Crisis Intervention Certified Officers. So there's different degrees or levels of training. Alex comes to us with a degree which is years of experience, which, you know, our officers don't have access to. So they are trained to some degree, but to develop the partnerships and to spend time on the referrals and understanding the behind-the-scenes, diagnoses, that's not something that officers are trained to do, nor do we expect them to. Our purpose is to more look at the criminal side of things, but it becomes more complicated when you have different types of victims and different people who are struggling with different disorders.
And based on the amount of calls and the response that you get with embedding Alex into the program, is it possible you guys could be adding an additional social worker as well with time?
If you're asking.
There's a part-time person that's going to be
Right.
hired, we're working on
Okay.
identifying somebody now. That's
Okay,
already
great.
budgeted for.
Okay.
If you're asking me, we're going to outgrow our office because 6 people won't fit in there. So, but that's my preference.
Yes.
Yeah.
But I think the point is too that we will be tracking it with RNP
Yep.
to really look at what is the volume, what do those numbers look like, to then really identify what would be the next steps, whether that mean build capacity, and what does that look like over time. There is a data analysis component to the program, so we can look at what's happening here in Norwalk.
Yeah, that's part of my role as well right now is tracking the calls that I go to. What kinds of calls are they? How am I responding to them? What referrals am I getting them to? So we have that data set to say, this is what we were receiving, this is our outcome, and how is it being utilized so that we can identify where is there more need, what can we do to continue to better serve.
Mm-hmm. And so RNP is helping with Stanford, Norwalk, any other police departments that you guys?
We're going to be working with Stratford
Okay.
as well.
And this is a contract position or you're a full-time city employee?
This is a contracted position, yeah. So I'm an employee of the Recovery Network of programs.
I see. How long is the contract for?
That I can't speak to. I don't know.
A million years.
1 year.
1 year. 1 year.
Thank you.
I know they have a lot of bilingual individuals in this area that need this type of assistance. What kind of?
So we're actually in the process of interviewing the second candidate right now, and that is one of the key things that we are looking for. Bilingual is, to your point, but not only Spanish, we have a large Haitian population, so luckily we have many officers that speak multiple languages here. We also have, if needed, language lines that we can fall towards, but even more importantly, we have other social service providers, like that are able to help us in the community so that we can, when we're connecting, we have clear understanding and communications. So, and I'm hoping that before everybody leaves, we get a good picture or, our shoulder-to-shoulder partners because these are all people in our community that we work with and talk to from our CCT team or on a regular basis that we partner with.
So if this contract expands for more than a year, where will the funds come from? Is there a fund in place for that? So the city of Norwalk.
Hopefully grants as well.
Well, any program that you start, you want to monitor the efficacy of the program and see if you're getting the bang for your buck that you expected. And obviously, this is a program that has such great potential. And if it can help people, if it can help reduce repeat calls for service. During the pandemic, we've had a significant increase in emotionally disturbed people, in drug addiction, suicide attempts. These are the kinds of things that we need to reach out and try to help. A lot of times people are acting out, and it's not their intention to cause a problem, but they're just acting out. They're frustrated. Sometimes they lose control of themselves. These are the kinds of things that we don't want a strong law enforcement approach. We want to be able to help people. We want to be able to reach out to them, talk to them, provide the resources, and perhaps there won't be another call for service. So it's a critical program. And with any program, if it's successful, we'd be foolish if we didn't continue. And we think there's no reason we feel it will not be successful.
Could RP give any type of context as to how the embedded social worker is doing in Stanford PD? Could you talk about that?
Sure, the social worker there is doing a great, you've met Carolina, so you know, she's doing a great job. I don't know if you were here when I spoke, but they've had, in our very first year of operation, we have served 300 unduplicated individuals, 800 interventions/connections to care, and with a 20% reduction in recidivist-type calls to the police department. So very, very significant. And to speak to the growth that has happened in Stamford, that initially came out of the Stamford budget, and then we were able to partner with the city of Stamford, and secured a federal grant to expand the program. So that's what we're doing right now.
Okay, so those numbers were just from Stanford PD?
Correct, first year of operation.
And that's from 2021 to now?
Yes.
So with those 300 people in the direct intervention, would that be equivalent to Alex going to the scene?
For a direct intervention, yes.
As opposed to giving resources for the 800 people, what is the 300 people?
That's just unduplicated individuals that she's actually worked with and done some kind of intervention or connection with.
How is that
So-
different from the 800 people?
It's not 800 people, it's 800 interventions, connections to care. So 300 unduplicated individuals means those are all unique individuals. Those are, nobody in there is repeated, and then the 800 are the actual services and connections to care.
And does that person actually go to the scene?
Yes, she does.
Okay.
Yeah.
And will Alex be doing that? Are you going to be on call, so to speak, like on the weekends if there's?
Not on call per se right now, but as Alex mentioned, I think this is a program that's developing, and one of the unique aspects and what we believe in so wholeheartedly is that it needs to be developed in tandem with what the needs are for the police department. So I think that time will tell of how that'll work, and then we're also recruiting for another part-time social worker, which will also help with some of those extended hours.
Okay.
I think to your point, what you're trying to say is it should be expanded beyond 9 to 5.
Exactly.
The benefit of 9 to 5 is we're covering 2 shifts right now.
Unknown caller.
Pardon me.
An unknown caller.
The benefit of having her from 9 to 5 is, number one, it's covering 2 shifts, right? So if one shift is 7 to 3, the second shift is from 3 to 11 p.m. So we're starting to be able to get to know the officers and the repeat calls for service that they're seeing, and we're setting all those things up. Absolutely, we want to expand our hours and have more people here and more feet on the ground doing it. Responding to the calls for service like we did about an hour ago before you guys got here is very much a part of the program, but for each person we're connected to, there's an entire family behind them that might need services. So if you have somebody who's having a psychotic disturbance, it's not just that person. There could be a family member, children involved, or parents that are victims, so there's so much more, and one case is not a quick fix. It evolves, and there's so much more that can be done. So where it's one piece at a time.
So if there is a case on the weekend that would have been something Alex would have done intervention with had it been within her 9 to 5, how is that handled?
The majority of the situations that we are able to access and turn good are from the follow-ups primarily, because on scene when things are very critical and chaotic, a lot of people will not be open to. It is when things are more calmed down and we can actually look at what's happening, what are the resources that person already has, who are the services that they're already connected with, and what are the gaps. That's not an immediate on the spot call that we can make. That's something that's going to require a meeting with our Connecticut care team, a meeting with the Norwalk Hospital social worker, and that's a lot of hours of legwork that goes into one person. So each person, like the 26 that we've, I know that 26 people doesn't sound like a big amount, but for some of those people, it was us being here several hours past, we were here till, I think, 9 o'clock that night, just addressing that one person and assisting their family and their needs.
And I just wanted to speak to that because I want to talk about it within the larger context. To your point, is that as I point out in my remarks under Mayor Rowland's leadership, that we actually have a youth services department. So we have master level clinicians. So we anticipate that when there's a child involved, Alex can make that seamless handoff to our youth services department because we have master level clinicians. We also have the community resource hub. So when Alex is involved and there's a basic need, not a mental health crisis, that we have our community resource, that our community resource hub, individuals who are full-time can support those families that are coming through the police department. Again, that approach that I talk about, that no wrong door. When it's a clinician that needs to involve, Alex will take the lead. But when families are involved, we anticipate right through city services, because the city already provides some of those services internally that we continue to do already. Just want to make that connection for you.
Thank you.